This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. So thanks for joining us tonight. My name is Nate Prallo, and I'll be giving us the overview of our program. Our chief in charge of recruitment is unavailable tonight, so you default back to the program director in these cases. Here's our contact information, and I'll have this slide up again at the end. So who is it that's speaking tonight? It's me, Dr. Nathan Prallo. Since I am in charge of this presentation, I get to pick the pictures. I've been program director since 2009, so this is my 15th year of doing this. I do outpatient musculoskeletal medicine, primarily neck and back pain, EMG, and when I'm not doing medicine, I'm hanging out with my family and dog. Lily might be joining in and barking at anyone walking through the neighborhood, so I apologize in advance for that. What do I do outside of medicine? I'll go backpacking with my family or camping, cooking, playing disc golf, and board games. And before I forget on that, every once in a while, I'll manage to cancel lectures for an afternoon, and we'll just have board games that I'll bring in and play that with the residents. Probably about time that I do that again for this next crew of residents. A couple things that we want to get out to you. Our pledge to you is if you have an application submitted by our deadline of reviewing them, and that will be placed on our social media, we will look at every application. It's not one of those that will just filter you out because of scores or location or where you graduated from or anything else. We will review your application. And if we offer an interview slot, there is an interview slot available. It may not be exactly the right time. We haven't quite figured out how to do that logistically, but we won't over offer any interviews. So our department is a relatively recent one. We were founded in 1991 by Dr. Randy Bradham, author of the usable textbook of PM&R. We just had Dr. Bradham in to give our residents some lectures a few weeks ago, and he's still doing great, still on top of things, and really a great teacher. And he set us up really well as a program. If you've ever met Dr. Bradham, this sparkly medical jacket absolutely fits his personality. We are one of over 100 ACGME accredited and more than 60 non-ACGME residencies and fellowships at the IU School of Medicine. We are either the largest medical school in the country or the second largest, depending on if we or if Illinois add more medical students in a given year. We have over 1,400 medical students, over 1,200 residents and fellows among all of the different programs. We are located in Indianapolis on the campus of Indiana University, Indianapolis. This building in the picture is our Ruth Lilly Medical Library. The Lilly Drug Company is headquartered in Indianapolis, so it really gives some nice research funding to a lot of different programs through the university. It's a great medical library, but the best part about it is almost everything is available electronically. So wherever you travel around the town, you can have what you need as research materials. The hospitals and clinics that you'll be rotating with for us, the Rehabilitation Hospital of Indiana, it's our primary location for inpatient training. It's a 91-bed standalone facility. This is our physical therapy gym. Behind that wall to the right is our occupational therapy gym. Really nice facilities, great people working there. Our children's hospital, Riley Hospital for Children, draws from all around the state of Indiana, and we do both inpatient and outpatient peds rehab there. Our VA Medical Center is absolutely fantastic. We have inpatient and outpatient services there, prosthetics and orthotics, chronic pain management, really nice facilities to help work on patients who are really deserving of our care. We are in the process at Indiana University Medical School of building a brand new hospital, replacing two of our primary teaching hospitals. Um, and in addition to building the new hospital building, we're getting a new medical school building. And that will all be done in 2027 if things go to plan. And all of that is right next door to our headquarters, the Neurosciences Center. This is our headquarters, along with neurosurgery, neurology, psychiatry, neuroimaging, and parts of ENT. And all of us are housed in the same building, working alongside each other, which works out very nicely for curbside consults, really close collaboration among caregivers. So if you have, let's say, a patient with multiple sclerosis and you're seeing them for functional deficits, but you find out they haven't seen a neurologist in a number of years, you can walk one hallway over and have a world-class neurologist ready to give you some advice and possibly even see the patient the same day. So if we had been doing in-person interviews this year, unfortunately we're not, you would be joining me at 9 a.m. in those seats, and we'd wander around the Neurosciences Center, and you'd get to see what an awesome place this is. Our outpatient clinics around town, really fabulous facilities, always blue sky, nice flowers, even in the middle of winter. Oh, perhaps not. We get all four seasons in Indianapolis. It's really a great location in the country. Your curriculum, we do 2-month rotations in stroke, traumatic brain injury, and spinal cord injury during your PGY2 year, plus 1 month of complex medical cases that are inpatient cases. You'll also circle back and do a month of complex medical cases as a PGY4, kind of to make sure that you're ready for boards, and especially if you're going to be doing a job that has inpatient as a part of it. It lets you refresh your skills on that, and it's not just preloading your entire career on inpatient and then you never see it again. In your PGY3 year, you'll pick up peds and then general at the VA in your 3 and 4 years. For outpatient rotations, we have a great variety of all things outpatient: musculoskeletal, neuromuscular, spasticity, sports medicine, chronic pain management clinics. You will have your hands on more injections here than you can imagine. We once had an interviewee ask one of my residents, when was it that you will first get a chance to do injections? And he happened to be on a particular rotation, started July 1st of his PGY2 year and had an injection come up the first week. So 7 days into his rotation, he was already doing injections. And to help along with that, we have a month-long rotation as a PGY2 that we call our injection boot camp. You are working with our injectionists specifically to train you up on how to do injections, how to manage the equipment, how to interpret what an ultrasound machine is showing you, whether it's muscle or bone, blood vessel, nerve, what have you. And this lets you be prepared for any other injection during your career when it comes up. You're not trying to fumble around and figure out, how do I run the machine? How do I grow a third arm so that I can run the probe and everything else? You already have that experience under your belt, and you can just focus on learning a particular injection. We have a 3-month rotation in EMG. We rotate with PM&R residents and neurology residents together. Now, the nice thing about this is our neurology residents at IU do a 2-month rotation. And so at some point during your 3-month rotation in EMG, you're going to have a brand new neurology resident coming on service with you. And one of the best ways I think to learn how to do EMGs is to try to teach someone else how to do EMGs. So either in your second or third month on EMG service, you're going to have this new neurology resident. You're going to help bring them up to speed on how do you run the equipment, how do you design a study, how do you perform the study, how do you write up the study, how do you interpret the study. And that's really going to help cement the principles of EMG in your own head so that you can come out of this 3-month rotation with a very solid foundation. We also have some elective time that's available if you want some more EMG time, and a number of other physicians outside of our EMG lab who perform EMGs as well. We have cancer rehab services. We have a functional restoration program, which there are not too many of these in the country. This takes a look at people who have chronic pain issues, and they've run through the system. They've done the therapy, the injections, maybe had surgery, maybe even gone through spinal cord stimulator trials or things like that. And they come out the end of it with ongoing pain. And it's a sad reality of our medical system that we spit out a lot of people and just put them on drugs and that's it. What the functional restoration program does is it takes a look at these patients, reviews their case to see is there anything that's been missed. Do they have the wrong diagnosis? Did they miss out on certain treatments? But then even if that's all been done, we have some very specialized physical therapists, pain psychiatrists who work with these patients in a intensive day treatment program. And we've had some surprising results. People who had been written off on disability and there's nothing we can ever do with this patient. We've run through the functional restoration program and gotten them off their medications or gotten them back to an employable level of function. It's really been exciting to see what this program has done, and you'll get a chance to rotate with them and learn what they do. Here's a look at our rotation blocks. Far too much detail to go into all of this, but the top segment for our 4 residents per year, you can see how they rotate through inpatient services and outpatient, getting your boot camp, getting some consults mixed in, and among our different facilities. Lectures. Our lecture day is Wednesday afternoon, starting at noon and running till 5 p.m. And we purposefully set it up so that you finish at 5 o'clock, no matter how many lectures. If we only have 1, you'll start at 4 and be done at 5. If we have 3, you'll start at 2 and be done at 5, and so on. So that there's not any question of once you're on the road for lectures, you aren't expected to return to service unless you're on call. We have a rotating curriculum. It repeats every 12 months, so you'll get that 3 times during your career with us. It includes a research curriculum, and you will be required to do a research presentation project, whether it's a case report or poster or a bigger study during your career with us. We have quarterly diversity sessions, yearly financial literacy sessions, monthly journal club, monthly morbidity and mortality sessions. And integrated into our entire lecture curriculum is the lifestyle medicine curriculum through the American College of Lifestyle Medicine. And this takes a look at 6 key pillars of a healthy lifestyle: sleeping, diet, relationships, managing stress, and so on. These 6 pillars are things that we talk about with our patients all the time, but through the lifestyle medicine curriculum, you can become certified in lifestyle medicine and have that as part of your advertising as you go out into the world. We have adaptive sports programs, sporting event coverage, sports physicals that you can do. We have elective months in your rotation schedule, ultrasound and injection workshops, EMG workshops. We even have an overseas faculty member, Dr. Christine Groves. She heads out to Kathmandu, Nepal every so often and spends a month or 2 there. She was actually one of the first boots on the ground after the pretty devastating earthquake that they had in Nepal, helping treat spinal cord injured patients back when that occurred a number of years ago. We almost had a resident rotate with her back, and then COVID happened, so that didn't happen, unfortunately. But we're trying to figure out if we can get a resident to go out and join her in Nepal. We have a fellowship in our PEDS rehab program, and then our interventional pain medicine fellowship through our anesthesia department at IU. We've had a number, I think we're 3 or 4 years in a row where we've had one of our residents get into that pain fellowship. And pretty much anyone that I can think of in the 15 years I've been doing this who has wanted a fellowship has gotten the fellowships that they want, really excellent fellowships and really well prepared. Your outpatient clinics are typically going to be one faculty member to one resident. We don't have any interventional pain fellows in our program, so you are first in line for experience. This is a huge thing that you need to consider when you are looking for residency programs. You don't need to wait for the fellow to get their 10 procedures before you get your hands on. Inpatient teams are always going to have a physician, but we have advanced practice providers along with so that the workload doesn't get too busy. We have a dual mentorship program where you will be linked with a faculty member and a PGY4 when you join us as a PGY2 to offer mentoring. And then when you become a PGY4, you'll return the favor and we'll link you up with a new incoming PGY2 to be a resident mentor for that new resident.
5 minutes remaining.
Thank you. Our department chair, Dr. Flora Hammond, has been our department chair since 2009. And rather than go through our whole faculty, I just want to touch briefly on between Dr. Hammond, myself, and our 3 assistant program directors, we have over 50 years of experience in leading Indiana's PM&R program. And that speaks huge amounts of confidence in what we think of this program and how stable it is. I want to touch briefly on research also. We are one of the model systems for traumatic brain injury awardees. We have had this 3 times in a row, so really a great experience that you'll have in all research, but especially in traumatic brain injury. As we're wrapping up here, since you don't get to visit us in person, I'd like to just take you through Indianapolis briefly. We are the 18th largest city in the country. We are known as the Circle City for our downtown city circle. This is Monument Circle, the Soldiers and Sailors Monument. Indianapolis is second only to Washington, D.C. in terms of the number of war memorials. And I'm not really sure why that is, but we've got a lot of park areas and memorials around the city. The city is incredibly walkable. This is White River State Park, right in the middle of downtown. This green space is used for festivals and concerts. The NCAA Hall of Champions is immediately on the left. Our baseball stadium and football stadium are off to the right. Our zoo is immediately behind us, and all in front of us is hotels linked to our convention center. We have any number of conventions that come through here. My favorite is one called Gen Con. It's a gamers convention. If you are a gamer at all, board games, role-playing games, you need to make it to Gen Con well, several times in your life, not just at least once. We have the world's greatest children's museum. The Indianapolis Children's Museum, absolutely amazing. Our zoo looking over downtown, great place to take family and kids. Tons of festivals through the city. The state fair is every year in August. We can fry anything that you come up with. We'll fry Twinkies, we'll fry Pepsi, we'll fry butter. Probably not the healthiest, but it sure is good to eat. Lots of festivals all around town. Great restaurant city. But we do work it off. One of the world's largest half marathons every year in May, running from downtown out around the Indy 500 track and back. Some high ropes courses, rails to trails, lots of places to walk through the city and burn off those calories. A little further afield, my favorite places to go hiking, Turkey Run State Park Trail 3 on the upper left. That is the water, there is the trail. Indiana Dunes, where I grew up, salt-free, no sharks, and great hiking, lovely landscape. Down in the bottom, the Little Smokies of Indiana, Brown County State Park, absolutely gorgeous. Plenty of sports too. We have a minor league baseball team. The Victory Field has been named the best baseball stadium to watch a game at. Lucas Oil Stadium, bottom left for the Colts. We also had the U.S. Olympic swimming trial, the largest swimming event ever earlier this year. It was absolutely fantastic. The Pacers and the Fever, we have Caitlin Clark. I don't think I need to say anything else beyond that. However, I do want to touch on this, the world's largest single-day sporting event, the Indy 500. If you don't come here for residency, you at least need to come here once in your life to check it off your bucket list, because it's absolutely amazing. The cars are incredibly fast. It's great drama, and the people watching is perhaps even more amazing. So hopefully this has shown you how you can become the eye in Indy and join us. I'll throw this contact information up, and we will open ourselves up for any questions if we have any time left.